Welcome to The Right Chamber, the podcast that takes you inside the NHS to explore what really makes a hospital a hospital.
Each episode, we sit down with the people who keep healthcare moving, from doctors, nurses on the front line, to students, the support teams, administrators, corporate staff, and everyone in between. These are the voices that often go unheard, but together they form the heartbeat of our hospitals.
Our aim is simple: to share authentic stories that are accessible to the public, meaningful to NHS staff, and a reminder that healthcare is more than treatments and wards. It's a whole community working together.
So whether you're part of the NHS family or simply curious about the people behind the service, join us as we open the doors to the conversations that matter here in the Right Chamber. Samantha Fisher is the lead alcohol clinical nurse specialist at the Dudley Group, with a specialist career in addiction nursing since 2008. Passionate about improving care for people affected by alcohol dependency, she's a dedicated advocate for both her patients and clinical team. Samantha brings extensive frontline experience, compassionate leadership, and a strong commitment to supporting recovery and reducing stigma in addiction services. Navraj Dhesi is a recovery advocate, speaker, and founder of No More Pretending. Following his own struggle with alcohol addiction, he has now been sober for 14 years and uses his lived experience to support others affected by alcohol harm, particularly within South Asian communities. Through advocacy, storytelling, and social impact work, he's helping break stigma and create pathways to hope, connection, and recovery.
Welcome back to The Right Chamber. I'm Victor.
And I'm Jasprit. Last time we discussed the harms of alcohol. Today we're shifting the focus toward recovery, resilience, and the reality of hope.
We're exploring what it takes to reclaim your life after addiction and highlighting the support networks right here in our community. Joining us are Sam Fisher, offering clinical expertise, and Navraj Dhesi, sharing his powerful journey and experience and advocacy.
We'll be discussing real stories of transformation, culturally specific support in the West Midlands, and practical advice for anyone seeking help.
All right, let's get started.
Samantha, would you like to introduce yourself again?
Hi everyone, I'm Sam. I'm the lead alcohol clinical nurse specialist here at Russell Hospital, and this is Nav.
I'm Nav Dhesi. I'm a recovering alcoholic, and I run an organisation called No More Pretending.
So before we get into the whole recovery process, would you like to tell us about how you got involved with Sam's
With the ACT team.
With the alcohol care team,
the alcohol?
because I know Nav professionally.
Yeah, sure. So it was part of my recovery. So I got sober through a 12-step fellowship. And as part of my recovery, I realised that there was a lot of people from my community that weren't coming into the rooms, or they'd come in and they wouldn't stay. My journey was different in the fact that I came in and, I was the only brown face in the basement of a church and I was terrified. But I managed to stay because for me, I knew that if I carried on drinking the way I was going to die. So as I progressed with my recovery, we looked to do some work to see how could we better engage with our own community. And as people came in and didn't stay, we got their contact details. We spoke to them, and the same thing kept coming up. Representation, like, I'm the only one there, or people aren't going to understand my culture. They're not going to understand me. Any addiction is a very isolating illness. People kind of come in alone, and if you put that through the lens of culture, that can just multiply that feeling of feeling alone and misunderstood. So we did a lot of work within 12-step fellowship in the Midlands to kind of create these spaces, and we looked at, if people aren't coming to 12-step or NHS, how can we better improve that touch point? And that's where we learned naturally from alcohol care teams. And, it's a team where people involuntarily end up, people are struggling, they might have a fall, might drink too much, and they'll end up with that team. So we built that relationship to say, well, look, if anyone's looking for help, and this was irrespective of culture, if anyone's looking for help, there's a free 12-step fellowship out there. And, we're all in recovery ourselves. So it's not our job. We don't work on case by case. For us, it's that one alcoholic connecting with another, because that's how my journey started. I didn't know how to stop and it wasn't until I connected with another alcoholic.
So in the last episode, in episode 1, we talked about the harms of alcohol In this episode, we'd like to talk a little bit about recovery and the support that people can get. Shall we do that?
Yes. So when our patients are in hospital, we, as I touched upon before, the alcohol care team do some personalised, person-centred assessments on all patients that are referred and we see, and we offer them referrals into different organisations for support. Namely, in Dudley, it's Atlantic Recovery Centre, which provide the community alcohol support. But in other areas, Sandwell, it's Cranston, Worcestershire, it's Cranston, and in South Staffordshire, it's a service called STARS. And they're all commissioned to provide support in the community. And people can find this locally. Every local authority has a service that offers support for community alcohol. But we also refer into different support that could be talking therapies, it could be Alcoholics Anonymous, Cocaine Anonymous, and it could be Punjabi AA, which I'll lead on to Nav.
Yeah, so from there's a number of 12-step fellowships out there. Obviously, normally ends with an anonymous or Cocaine Anonymous, Alcoholics Anonymous, and they all follow the 12-step process. And there's been a lot of work in the Midlands area to kind of create more cultural competency. So there's been a number of kind of culturally specific meetings that have been stood up. So you kind of have South Asian focused meetings, and the purpose of this is not to create a fellowship within a fellowship. They're almost gateways into long-term recovery. It's about representation. It's about early in that journey feeling heard, feeling recognized, feeling represented, and then going on to kind of connecting with broader networks of people from diverse backgrounds. Because, the richness of my recovery comes from connecting with people from all sorts of different communities.
What are the challenges or the barriers that kind of limits how well someone can recover? And I guess that's where these support systems can then step in to help to start breaking down these barriers. So because it must take a whole lot to stop something like, well, any addiction, as we mentioned, but what are the barriers?
I think it's really difficult when you have got an addiction, because especially with alcohol, because people become really focused on a detox. But a detox is actually one of the easiest parts of recovery, because recovery is lifelong. It's hard work from the person. There's not a magic pill that is going to mean that someone that you can take and that you recover. You've got to change your whole life. So people come in with thinking that this detox that might last 3 days, it might last 10 days, and they would get discharged from hospital or a detox facility and think that they're cured. But actually it takes a lot of hard work psychologically, psychosocially, looking at your whole life and getting support for, what are you actually using alcohol for? Because if you're using it to manage pain, then you need help with the pain. If you're using it to manage loneliness, then you've got to change your whole life to make you be less lonely. You've got to attend groups, you need to attend some kind of support, you need to get hobbies just to make you busy, because once you get back in that same routine, it's when relapse can occur.
So I think the first step obviously is admitting that they have a problem, and then second one is looking at the root cause of why they drink, and then, like you said, Lloyd, figuring out how to get rid of that.
Yeah, I think your point is really, really interesting, because when you think about detox, maybe it's the medic in me. Immediately, you just think about the medical part of it, of detoxifying the drug from the bodily system or stopping the drug. But it goes far beyond just stopping the drug. It's about how do we then maintain this
And that's
recovery?
the hardest part, because sometimes it can be that it's a man and wife and they're both drinking alcohol dependently. One comes to hospital with a life-limiting illness that alcohol could have caused, you detox the patient. You advise both, both husband and wife that if you continue drinking, there's a good chance you could die. But if the other person who you're living with isn't going to get some help and stop drinking, you're discharging the other person back into that environment where they're going to be back around alcohol, and it's very easy to fall back, and it's about having these honest conversations with family members and about ensuring that other relation is supported as well. So it's, having discussions with family and involving them in is so important as well, because it could be like even just their favourite pint glass that's still on the table when they go home, asking family members if they could remove that, as a trigger. There are so many things that you have to consider. But ultimately recovery does happen, and we have many successful stories, which we're delighted to say, of patients that have recovered through our help through the alcohol care team at Russell's Hall. So, it does work if you're committed.
I think just to build on that as well, I think one of the biggest barriers to entry is misunderstanding. That's both at an individual, family, and community level. Just the term alcoholic is a very loaded term. I use it quite openly, but as soon as I say I'm a recovering alcoholic, everyone has a stereotype of what that looks like. Yet at the height of my drinking, I was a high-paid professional. I never drank every day. I had the wife, the car. From the outside, it looked like, that typical material. It ticked all the boxes. Yet on the inside, I was finished. I was suicidal. I'd drink and not want to wake up. And you touched on so many points there. I think what people don't realize is that it's an illness, and it's a family illness. It's very easy to focus on the individual, but any addictive behavior, it impacts all the relationships around them. And then the family, the loved ones, the friends, they all start to suffer as well. And that detox thing, I think it comes back to fundamentally misunderstanding that this is a lifelong illness. It's like becoming diabetic. Certain types of diabetes, you can't reverse it. And for me, I haven't drank in over 14 years, but I can never safely drink again because I'm alcoholic. Because once I start, I can't stop. So it's never about how far I am from the last drink. It's about how close I am to the next one. And that's where it came back to the behaviors you were talking about. Detox is just, you can look at it very black and white, where actually from a physiological, we're removing alcohol from the system. And, I think when you look at professional services, they focus on two of the three key areas we need to. So there's the physical aspect, there's the mental aspect, we talked about. But then what we try to focus on is that cultural aspect, the person's lived experience. Because when you look at that environment at home, we have to understand what biases are you bringing to how you evaluate that environment. I come from a Punjabi community which has a very different social makeup to your traditional European model, and that drives different behaviors, values, and these are the things that we need to kind of encompass into people's long-term recovery.
Being Punjabi myself, I know how hard it is for people to accept that alcohol is a problem. So I think support in the communities a very important step as well.
And I guess leading on from that, my question is then, from your experience with all the support available, what do people tend to find as the most useful tool in kickstarting that recovery journey, or maybe from personal experience?
I think it's like knowing that they're not alone. I think we've already touched upon that, and that there is support out there. I think just knowing that there are services and people available that can relate is always really beneficial, but also being educated on, sometimes it's about education on their, so for me, it's like I come across some patients who are really acutely unwell, because of their alcohol use, and educating them on alcohol, their diagnosis, what that means, what that looks like. So I just think education is probably underused, but is probably most valued. And just knowing that they can call us if they
Yeah,
need
they're
support.
not
Once they've
alone.
kind of been our patient, our phone line is there. And
Yeah, to build on the education, I think it's about identification. You know, at the end of my drinking, I wanted to stop, but I didn't know how to. I'd drink when I was happy. I'd drink when I was sad. At times, I'd be crying drinking because I couldn't understand how I'd got here again. And for me, my journey in recovery didn't start till I connected with another alcoholic. And the power of that was everybody else was focusing on the drink. They understood what was going on the inside. They understood what it was like to lose conscious control, to not be able to say no to that first drink, to be at a point where once I start, I can't stop. It's a spectrum. Yeah. And people think it's very binary in that, alcoholic, park bench drunk. Whereas, no. I was, to look at me from the outside in meetings, I was just a normal guy, but I was struggling. Once I picked up, I wouldn't be able to put it down. And I traveled a lot with work. So I thought, I'm not hurting anyone. But actually, I was damaging all the relationships around me through atrophy because I just wasn't there. I just wasn't present. You have to realize that I was quite early on that journey, whereas the difference between me and, say, somebody that you'd class as, a park bench drunk that's coming in for there's no difference. They were just further along on that journey. I could see that my binge drinking, it was getting bigger and bigger, and the binges were getting closer and closer. So I could see that actually it was only a matter of time before I was going to become a daily drinker.
You have like a stereotype of like what an alcoholic's supposed, like you said, it's a, park bench drinker, disheveled, jobless person,
Waking up shaking.
waking up, and
Always.
then that is an alcoholic, but not someone who comes in suited and booted and has a really high paying job. He can't be an alcoholic.
and actually, the more you earn, the more you drink. Actually on the scale, because you can afford it, you buy, you just look after yourself, you eat, you don't, it's not alcohol or food, it's alcohol, and food, and you attend your health appointments, but on the scale, usually it's actually the more you earn, the more you drink. And these people in high powered jobs should be asked, and sometimes there is that, stereotypical that they're not being asked the questions of how much are you drinking, because they don't look like, the stereotypical but we touched upon that last time, like elderly, our eldest patient is in their 90s. We should be asking every patient. We have a lot of referrals of patients in their late 70s, 80s, because they're high risk, they're lonely, they've had bereavements, they're in pain, they're managing, they're having a drink, but they're not asked because they're elderly.
Oh, yeah.
And we should be asking everyone about their alcohol use.
How you mentioned about how it can be a spectrum, and it isn't one, one image that you will see. So I suppose going on from the previous question, which I asked, which is what's the most useful tool? And I think what we said was just awareness, knowledge, knowing that there is help out there, knowing that you're not alone. That's kind of the first thing. If there was someone who is keen to recover, listening to this podcast, what advice would you give that person? What should their next steps be?
It's really good that they want to reach out, but they need to get proper support to have, because obviously alcohol dependency, as we discussed before, you can't just tell someone just to stop drinking. So they really need to reach out and access support. Like Nav said, the Anonymouses, Alcohol Anonymous is fabulous. There's smart groups. For Dudley, it's Atlantic Recovery Centre. Get yourself in with some support. But also have a look around, because there's lots, it depends, it depends what they also, because you need to change your whole life as well. So it's about getting out there and seeing, there is also like Breaking Free online, which is like a psychosocial kind of online tool, which is really good. There's also absolutely brilliant support now. You only have to Google like the Soberistas for professional women, which is a forum online which is a great supportive tool. There's lots of forums. Reach out really. You can always contact us if they wanted just some support of where to go, because it all depends on what you're using alcohol for. But just you have to reach out really and get some support to look at the deeper roots of why you're drinking.
Yeah.
What about communities like Punjabi communities? Because there's this whole stigma to being called an alcoholic. Where can they specifically go to find help? And I'm not just talking about like Sikh communities, like we talked about Muslim patients, because it's taboo for them to drink. Like, where can they get help?
We can look at this completely from the point of view of the person who is suffering, but then also it isn't just them, it is also the support around them. And you mentioned as well another key thing, which is that the person suffering might not actually know how far gone they are, and it might be the family member who actually spots that their loved one is struggling.
There's also Al-Anon for friends and family support, and Alateen for teenagers, and they're all of these are vital to recovery for family members.
What's your hope? Is there hope? What keeps you motivated in this work that you're doing?
I love my job. I love that I get to talk, and get to know my patients on a different level and their families. I'm really passionate about being an advocate for my patients and their families and making sure that they get the best care in hospital and outside. And that's something that I am proud of myself for being. But I have several patients who have not engaged with community services, but for whatever reason, but they've engaged with me and are now alcohol are in recovery, and they've been in recovery. My one patient's been in recovery now for over 2 years, and I've got several others, and that is what keeps me going, is these patients there that I have to look at it from a medical model, is that their health issues. One of my patients had a cardiac arrest, and now he's been seen by cardiology and his heart has returned to normal. Another patient's liver, has gone from decompensated to compensated. Like, how amazing is that? Like, honestly, people do recover all the time, and don't think it can't be you, because it can be you. I am witness to so many amazing stories every single day. Families being reconnected, people's just getting back into work, or just
Wow.
honestly just amazing things.
Nav, what's your motivation? What?
Before that, I think just a huge thank you to Sam, the team, and the wider alcohol care teams, because we've got a touch point with all the alcohol teams, with all the local hospitals, so across all of the Midlands. And what we found with developing that pathway into recovery is that it's given us access to people earlier in the journey. Whereas, they might have a fall, a trip. So, it's not always like, that they end up on Sam's team, they need detoxing. Sometimes it's, might have had, too much drink. It's just catching people earlier in that journey. And, whilst, they're in hospital, they're looking for support. And what we do is we reach out, we connect with them. And there's been so many tales of, people that have then ended up in recovery probably earlier than they would have. So we've managed to kind of connect with them before they're in crisis, before the family leave, before the financial issues. And, and it goes on to my motivation that it's seeing that hope come back in the family's eyes. Recovery it gets easier. So I mean, it is definitely hard at the beginning, because you're kind of completely changing the context of how you live, feel, everything. But as you grow in that, today I love my life. I live the life that I was looking for in the bottom of a bottle. I've got a beautiful wife, 2 kids that have never seen me drink, and there's happiness and laughter in the family. And seeing that come back into other people's lives, it's just how the fellowship works. You know, that's what keeps me sober, continuing to work with other people as well.
Honestly, this is amazing, and I really hope those listening today have picked at least one or few things, if anything, just that. Be aware, get some awareness, and then reach out. You're likely not the only person, and you will find like-minded people, and that might just be what you need to kickstart your journey into that recovery, and then access the various supports that is available. And it sounds like there is just so much work.
There's so much
out
work
there. Yeah.
Find a support that works for you.
Yeah.
That's the key. Is find something that works for you, and go from there, really.
And don't give up if one doesn't work.
Yeah, exactly. Don't ever give up, because recovery is possible for everyone.
Absolutely. Thank you so much. Our time is fast spent. And to those listening at home as well, thank you for staying on, listening to us, tuning in. We always appreciate the support, and we will see you at the next one.
Thanks, guys.
Bye.
Remember to stay connected with us on social media. Follow us on Instagram and TikTok at RGUCMS, and subscribe to our YouTube channel, RGUC Media, for more exclusive content and updates. Thanks for tuning in to the Right Chamber podcast. Until next time.